well, thank you everybody for joining us here today. My name is Reginald Parson, and I'm the Deputy Director with the Maine Paid Family and Medical Leave Program, and I'll be moderating and leading tonight's webinar with the Maine Paid Leave Coalition. With me is Sarah Price and Belinda Donovan, our wonderful partners at Ethos. They'll be assisting with us with the public education campaign on paid family and medical leave. Also present is Luke Monahan, the director of the program. We are extremely pleased that you are joining us here today, and I would like to share that today's event will be recorded and posted on the department's webpage on paid family and medical leave. I would also like to take this time to thank the Maine Paid Leave Coalition for being a wonderful partner and working with us to host this webinar. And so now what I'm going to do is, before we start, is to hand it off to our friends at the Paid Leave Coalition to see if they would like to make any remarks. So I will check the attendance screen, and if anyone from the Paid Leave Coalition would like to raise their hand, I will certainly recognize you. And there's Katie. Great. All right, Katie, I think you can begin.
Hi, everyone. My name is Katie Reed. I work at the Maine Women's Lobby, and we convene the Maine Paid Leave Coalition. The coalition is a group of more than 40 partners working together to continue to support the implementation of a strong paid family medical leave program. Our coalition has been a part of this work since 2019, and we have worked on informing legislation, supporting implementation, and we are very excited to be a part of this event tonight. So that being said, on behalf of our 40-member organizations, we are happy to be a part of this, and we hope that you all get more information about paid family medical leave and reach out to us in the future. Thank you.
Awesome. Thank you, Katie. So now I would like to take this time to recognize any members of the Maine Paid Family and Medical Leave Benefits Authority who may be in attendance. So if there's anyone here from the authority, please raise your Zoom hand and I'll be happy to recognize you. Check the list, and I'm seeing none. All right. So, today we're going to provide you with a brief overview of the Paid Family and Medical Leave Program and some key information to know as we continue to move forward with implementation of this new and exciting program. After the overview, we will also address any questions that you might have. If you have a question as you're listening to the overview, please put your question into the chat and we will do our best to address them. So with that, we can go ahead and actually, before I begin, I will go ahead and share my screen. So please go in 1 second. All right, so today we will provide a very brief overview about the Paid Family and Medical Leave program. But again, we will definitely be happy to take any questions that you might have at this time. So I will begin with a general overview. So in July of 2023, Governor Janet Mills and the state legislature signed into law the creation of the Maine Paid Family and Medical Leave Program. The law will provide up to 12 weeks of paid leave for family, medical, or safe leave, or leave related to a family member's upcoming military deployment. And we'll be more than happy to get more into those reasons later. And then finally, this law will apply to most employers and employees in the state of Maine, with the exception of the federal government. Again, just to kind of get into some of the reasons to take leave. So we provided some basic general examples here. One example could be to, care for a new child, either through birth, adoption, or fostering, or to care for a family member who may have a serious health condition. For medical leave, this is to care for your own medical needs. And then for safe leave, which is to either help the employee or the employee's family member stay safe after abuse or violence. And then finally, when it comes to military deployment, it's a family member that is in the active service, and they might need to handle the family member need to handle the transition of that deployment. So these are some things, and I'll kind of slow down a little bit here in terms of what to expect, not only in 2026, which seems like a long way, but it's really not, but more importantly in 2025. So beginning in January of 2025, payroll withholdings will begin for the paid family medical leave program. And in the next slide, I'll get more into what the premiums are and the breakdown of that. And then
The slides are not advancing, we're still on.
So I think you gotta share the presentation mode, Sophia just said that.
Still on the first.
I think we're still on the first slide, yeah.
I am so sorry. Okay, I am so sorry about that. All right. So I think now people can see this, correct? Okay. I am so sorry about that little glitch. Okay, so basically this is what to expect in 2025 and in 2026. So beginning in 2025, payroll deductions will begin for the program, and I'll get more later into a different slide about the premiums and the requirements for that. But what we need to do as a department on our end is to adopt rules for the program. We have been working at warp speed to ensure that we have these rules done in a timely manner so that we can officially launch this exciting program. And then this is something for employees that you don't necessarily need to worry about, but the launch of the main paid leave portal that will begin in early 2025. And then finally, on May 1, 2026, benefits will go live for the program. So I'm going to take a little bit of time to talk about the premiums for the program, just so folks have an understanding. And again, if there are any questions, please feel free to ask. So the premium amount for this program is at 1% of an individual's wage rate that is split between the employee and the employer. Self-employed individuals and tribal governments can elect coverage into the program, so they're not required to participate into the paid family medical leave program unless they would like to. But if they do decide to elect coverage, it'll be 50% of the premium rate. And then I'm gonna break this down a little bit further in terms of just an example of, again, what 1% looks like. And you'll also see the number of 0.5% as well. So if you are an employee who is working for an employer with 15 or more employees, we use an example of an annual payroll of $1 million a year. So as you'll see, that premium amount will be $10,000. The employer will be responsible for paying 0.5% of that, and the employees would also contribute 0.5% as well, equating to 1%. If you are an employer with less than 15 employees, so if you're working for a smaller business that has, for example, under 15 employees, we use the annual payroll amount of $250,000. As you'll see, it looks a little bit different. And the reason why is that the employer of this size will not have to pay the 0.5%, but 0.5% may still be deducted from employees' wages to pay into the program. So that 0.5% can come entirely from employees' wages, or it's voluntary but not required. The employer could choose to pay that 0.5%. So just a little bit of a better breakdown in terms of the premium amounts based on income. So we use three general examples. So someone who's making, for example, around $35,000 should be paying no more than $3.36 per week. So their yearly amount for deductions for premiums would be no more than $175. If you're someone who's earning about $57,000, you'll see that you, as an employee, probably will be paying no more than $5.48 per week, or again, $285 for the year. And then finally, someone who's earning about $90,000 should be paying no more than $8.65 per week, or the yearly premium amount of $450. One thing I will kind of add on to that in terms of what the yearly premiums would be, they are capped at the Social Security wage limit, which is a number that's determined on an annual basis by the Social Security Administration. So just to remind folks that there is a cap up to the Social Security wage limit. So to talk about a little bit about eligibility and what to expect. So there is a reasonable notice requirement that's tied to this program in terms of the scheduling of leave. So if you are an employee that is seeking to take paid leave for one of the qualifying reasons that we talked about, whether that was family, medical, safe leave, or leave related to a family member's upcoming military deployment, you must provide reasonable notice unless it is an emergency. Proof also must be provided on why you're taking leave. And again, we might not get too much into the proof aspect, but we're certainly happy to try to answer any questions. But we're hoping to address some of the documentation that's required later in the process, and certainly before the application process begins. There's also an income requirement that's attached to this program. So to try to help folks understand what is the state average weekly wage, we did provide an example. So you also might be asking, what is the state average weekly wage? This is a number that's determined by the Maine Department of Labor on an annual basis. And so for 2024, that is $1,144. So in order for you to be eligible for the program, or one of the eligibility requirements is that you must earn 6 times the state average weekly wage in 4 of the last 5 completed quarters before accessing the benefit. So we use an example here. If you multiply $1,144 times 6, this is the amount that you would have to earn over that period. We know that workers sometimes work more than one job, and so that, in theory, once you apply, may help you meet that monetary requirement. And we will certainly, look at your wages during that period. And then finally, there is a provision in the law that talks about undue hardship. So the scheduling of leave, so you as a worker, when you're talking with your employer in terms of taking leave, the scheduling of leave must not cause an undue hardship. We have worked very hard in the comment period and in the rulemaking process to try to help both the workers and the employers really better understand what is undue hardship. And again, we're happy to try to answer any questions folks might have about that part. But again, the scheduling of leave, that is when the undue hardship provision may apply, and that will be based on the determination of the employer. But again, in the rulemaking process, we try to offer a little bit more clarity and understanding around that. So obviously there is a benefit associated with this upon eligibility. So the benefits will be based on a 2-tiered wage system. So individuals whose average weekly wage, so we're taking what you earn based on the number of jobs, whether it's one job or multiple jobs you have, we will look at what is your individual weekly wage. And if that individual weekly wage is at or less than 50% of the state average weekly wage, so again, we're taking that $1,144 number and essentially splitting that in half. And that will help determine what is 90% wage replacement for the program. And then any earnings more than 50% of the state average weekly wage, you will receive an additional 66% wage replacement. And one thing to keep in mind is that these benefits, the weekly benefit amount is capped at the state average weekly wage. And one more thing I will say about the state average weekly wage, it is again subject to change on a yearly basis. So when individuals apply in 2026, that number might look a little bit different, but we just wanted to give you an example, especially trying to help determine what is the income requirement on the state average weekly wage. So trying to get to the benefit amount to help folks understand what all of these very convoluted and sometimes complicated formulas mean. Again, we use the same type of annual salary that we did for premiums. So if you're someone who's earning around $35,000, your weekly wage should be around $673. So if we only looked at the tier 1 wage replacement, so how much are you gonna earn? You should be earning no more than $514 under a 90% wage replacement. But since you earn more than 50% of the state average weekly wage, we have to take into account those earnings as well. And so in that case, we looked at a 66% wage replacement, and that turned out to be $66. So at the end, you should be earning no more than $580 a week. Going to the average wage, so someone who's earning about $57,000, you'll see what their weekly wage is. You'll see what the tier 1 wage replacement would be, and you'll see the additional earnings that they have over 66%. And if we calculate those two numbers together, that is the weekly benefit amount. And then finally, you'll see that on someone who's on the higher income scale, what the weekly wage will be, what the tier 1 and tier 2 wage replacement. We put a little asterisk there to show what capping the weekly benefit amount means. So even though after all the calculations are done, in theory, this person probably should be making more in terms of their weekly benefit amount, but the state law requires us, again, to cap it at the state average weekly wage. And so with this particular side, we're gonna kind of touch on some other very important components about the paid leave law. So there are job protections surrounding this program. So if you are a worker who has worked for an employer for at least 120 days or more, you are entitled to return back to that job or a job that was equivalent to the one that you had, including any benefits that you might have been given prior to taking leave. And also these benefits are portable. So again, we know that the workforce can be very fluid and people work more than one job. So if you are working for one employer that's part of the state plan, and you move to another employer who's also participating in the state plan, you will not lose eligibility. Still doesn't mean that you don't have to apply. You still have to go through the normal application process. But these benefits, again, are portable. And then finally, when it comes to applying for leave, and we certainly hope to have more information out about this, but individuals will not be able to apply until early 2026. So please stay on the lookout for any information about that. So here's what we need you to do in the meantime until 2026 launches. So we definitely encourage you to go to our webpage on paid family medical leave, and that is at www.maine.gov/paid leave. On that site, you will find very up-to-date FAQs, and we are definitely updating them as much as we can as we are still in the building stages of the program. So we're actively engaged in keeping people informed. You will also find information about the presentation. So not only this presentation that will be up live at some point, but a general overview PowerPoint that we have as well. And then you can also find any additional information that is also available on our website. And in the meantime, we definitely encourage you to sign up for our interested parties list. This is where anytime the department updates the public about any components of the program, whether it's rulemaking or whether it's updating our FAQs, whatever that might be, please sign up. It's a pretty straightforward process. When you get to the homepage, you'll see right in the box where it says get notified by putting in your email address and checking a few boxes after that. You should be on the interested parties list. And then finally, the information that we do have online is available in eight languages as well. So with that, I will stop sharing my screen, and this is where we'll get to the Q&A portion. If folks have any questions, and Sarah is passing along some questions that we're getting from the chat. So is the employee premium, are they pre-tax or post-tax? And please feel free to chime in.
Yeah, so the wage base is pre-tax, and it's calculated similar to the state unemployment definition of wages. So in terms of deductions that come out before or after the premium comes out, is similar to the state unemployment definition of wages, but applied to a much broader set of employees in the state. Because state unemployment has a bunch of exceptions of types of employment, and Maine family medical leave applies to almost all employees in Maine. But in terms of what the 0.5% comes out of, it's pre-tax before your income withholdings come out.
And I did see Catherine's hand raised for a while now, so I might, if it's okay, to allow her to ask a question. Catherine, can you hear us?
I can. Can you hear me?
Yes.
Okay, great. I'm wondering about the January 1st premium that is due. Is that the entire amount, the 1% for all employees? We're a school district of about 450-ish employees. And because otherwise we're gonna have to calculate what the employee deduction is gonna be going forward after that.
So it's 1% of wages that are accrued in the first pay date that is in January going forward.
Okay.
And I know school districts have collective bargaining. I'm not sure if you're speaking to collective bargaining as well, but in terms of like when the actual deduction started, it's the first pay date within January going forward.
Okay, we have two collective bargaining agreements, so our teachers are next year, but our hourly staff and our salaried people who are not aligned are due on January 1st then.
Okay, yep.
Okay, thank you.
Thank you. All right, so we got some additional questions from the chat, so I'll ask them. So is the employer amount considered a business expense?
Well, so I think that's a question of like taxability of like if the employer covers the premium amount of the employee, is that a tax deductible fringe benefit? And the IRS is not giving guidance on that, so unfortunately we can't answer that question. I would speak to your tax professionals, your lawyers if you have one. But the IRS has not weighed in on if an employer covering the employee's portion of the premium is a deductible fringe benefit, and we're waiting on that guidance.
So one question that we also got is anyone excluded from contributing and participating in the program? So in terms of, I guess, using those terms, so basically the law is intended to capture as many employees and employers in the state of Maine. And we didn't get to private plan substitutions, but that still necessarily doesn't mean that you're not totally out of the paid family and medical leave law. But so I think the best answer is basically everybody's in.
Everybody's in. I mean, there's some very few exemptions that we have in proposed rule. And I think it's section 2B. There's certain types of employment like volunteers under certain definitions, wages for incarcerated people, federal employees. So there's a few special populations, but you know, the easy answer is pretty much everybody's in, with those very few exceptions in proposed rule. If you're an employee, and then if you're self-employed, you have to opt in for coverage. But if you're an employee, you know, Maine-based employee who is not a federal employee, basically you're in.
Next question we got, are these benefits taxable?
So the benefits, we're still waiting on guidance from the IRS for if the benefits themselves are also taxable. And hopefully we'll have obviously that guidance by 2026. We are looking to clarify the main taxability for main income tax in next year's session. But Reggie and I and the rest of the PFML administrators met with the federal IRS this summer. And they said they expect guidance to be coming soon. Hopefully this year about the taxability benefits. So we do hope to have that answer before benefits go live in 2026.
Yeah, and so it seems like we're getting quite a few questions about posters or handouts. So I guess the good news is, good news is we will have a poster.
And it is online now.
It is online now. So that is basically a poster that you will see in every break room across the state of Maine. That outlines the paid family medical leave program and some pretty important things. So yeah, it is available online.
Yeah, so that's at the BLS website where you get all your labor law posters, but we also have a link on our website, maine.gov/paid leave. There's a new section with employer resources, and the link to download the PFML poster for break rooms, your labor law poster, is now available as of today.
So that's pretty exciting. So, so if my employer has its own paid family and medical leave, can I take advantage of this? Can I take advantage of this additional 12 weeks?
So that's kind of a multifaceted question, I would say. So there is the private plan substitution process that if an employer has a certified substantially equivalent plan, and so plans over the next, 4 to 6 months before April 1st have to be certified as substantially equivalent. So if you have a fully insured product, an insurance plan that's provided by an insurance company, they need to provide those plans to the Bureau of Insurance in Maine, who will jointly provide certification of substantial equivalence along with us. And if the employer offers that type of plan that is substantially equivalent to our rules once finalized, the employer can apply after April 1st to exempt from premiums and have their employees covered under this private plan. It sounds like the question might be asking as well, if these paid family medical leave benefits can be used in addition to whatever employer plan you might have. And I would say that's a decision for the employer about how they want to augment the main paid family medical leave benefits from the state, if at all, or if they just want to go with the state plan, or if they want to go for a private plan substitution. So, I mean, it really depends on the employer and how they want to augment their benefits. The only kind of stipulation in statute and rules is you cannot, or any time taken under the federal unpaid leave act, the FMLA, the federal unpaid leave, has to be taken concurrently with paid family medical leave in Maine. So if you have an employer plan that, uses FMLA time at the same time, that needs to be taken concurrently with paid family medical leave. So you can't, in that sense, take 24 weeks if it's using both types of leave.
And the main unpaid.
And the main unpaid 10 weeks.
Yeah. So I think this also kind of goes to private plan. So what about an employer that offers an extended sick leave policy? Can we opt out?
So sick leave policies by themselves are not substantially equivalent if it's based on accrual times, so there's definitely employers out there that have very generous accrual time policies. But someone needs to, this is a benefit coverage, it's basically insurance coverage. So somebody starting, day one, week one, month one, needs to have access to a full 12 weeks of benefit coverage. That's the standard now in Maine with the state plan, and standard accrual plans don't provide that. It's PTO that you build up over months and years. But we will have, there's definitely information in statute and FAQs and proposed rules now about private plans, and we'll be adding more information about private plans as we head through the fall and winter.
So we got a question about, so if a child is born before May 1, 2026, can you take leave starting by, I'm assuming if a child is born, yeah, so I'm assuming.
A little bit before was the question.
Yeah.
Before and a little bit before
Yeah.
that.
So
Can you take leave?
yeah, we're probably going to be providing guidance on that as we get closer to 2026. A lot of states have a look back period when they start their benefits, and it's a question of how long that look back period is. If it's a month, 6 months. So if you have a qualifying event, and really it's just the bonding claims. If you have a qualifying event before benefits go live, can you apply for that benefit? So we'll provide, I think, guidance on that as we get closer to the May 1st, 2026 start date.
So shifting a little bit to talk about undue hardship. So what factors will be considered an undue hardship onto the employer? And I guess I could take that. Yeah, so again, this is something, so I guess maybe I'll start with this. So Maine is the only state in the country to have this term undue hardship in the statute. So some of the factors I would definitely say are in the proposed rule, and I don't want to misquote by trying to recite. Actually, I do have the rule next to me, so I guess I could quote what we put in the proposed rule in terms of what could constitute undue hardship, but you know, some of the process, I guess, kind of goes into, you know, looking at whether, you know, the impact on the operation of the business or significant expenses, considering the financial resources of the employer, the size of the workforce, and the nature of the industry. So I guess that kind of goes a little bit into it. But what I will say when it comes to undue hardship, this will be something when 2026 rolls around, that employers and employees are gonna have to navigate, and we're just gonna have to be candid about that. But that's some of the factors that are included. But I would say once the rule is finalized and adopted, I would certainly encourage folks to look at that proposed rule that gets a better understanding of the undue hardship framework. So let me see if I want to check the participant screen, make sure we're not missing any hands. I don't see any this time. So one other question that we got. So is Maine paid family medical leave separate or in addition to the Maine paid time off policy? So basically earned paid leave law, are they the same or are they different?
So they're essentially separate. I mean, the earned paid leave law is an accrual, mandated accrual of up to 40 hours, or excuse me, 40 hours. But it's separate from the Paid Family Medical Leave Act. Yeah, they will interact, obviously. It's kind of like having a sick bank at your employer, the same way you said that'll interact with, you know, this law. So an employee cannot be compelled to exhaust PTO time per statute. So that would apply to the earned paid leave time as well. There is per statute, there's a 7-day waiting period for medical claims only. So if you are taking a medical claim, your benefits actually don't kick in until your second week of leave in terms of payment. So people, you know, can certainly use their earned paid leave time in that first week, if they have it, to, you know, provide some wages in that 7-day unpaid waiting period for medical claims. I mean, I think that's one of the most important ways it'll play out. But they are separate laws, and they don't reference each other in the statutes.
So I know we definitely got this question a lot, just being out about. So what if a person lives in Maine but works in New Hampshire? Does the employer have to cover Maine paid family medical leave? I don't know. I'm assuming this employer is in the state of Maine. I'm assuming.
Yeah, it really depends on the circumstances, but we do have in our FAQs on the website, we use this state unemployment taxes or the state unemployment insurance program's definition of locality of work. So what's a Maine-based employee, quote unquote? And there's a 4-pronged sequential test that the unemployment program uses that's outlined in our FAQs. And we try to put it as plain speak as possible in the FAQs, but it's still a little bit complex, and it depends on the employee specifically and the circumstances. So for instance, if somebody lives in New Hampshire but is working 5 days physically in Maine, that's still a Maine-based employee. And if you have a remote worker who lives and works in Maine for a company that's in New Hampshire but doesn't leave Maine, that is also a Maine-based employee. But it really depends on the circumstances of the employee. So I would encourage anyone that has, you know, kind of cross-state employees to look at our FAQs and the locality of work 4-prong test. And certainly reference the unemployment, you know, statute if you have further questions.
All right, so another question we got, can the worker collect the Maine paid family medical leave benefit and their sick leave benefit? And then there's a second question tied to that. Is paid family medical leave independent of the other coverages? So, in terms of the benefits, so we do, I guess it would depend on the type of wage. So if these are, for example, short-term disability benefits, and someone is also collecting weekly benefits under paid family medical leave, we will not reduce your amount. The only times we will reduce your amount is if you're receiving any benefits under the main unemployment insurance program or the workers' comp program. But otherwise, other than those two, those are the ones that we will not.
Yeah, short-term disability does not offset, like Reggie said. And then we do allow the employer, with the employee's permission, because again, by statute, the employee cannot be compelled to exhaust sick time, but if the employee and the employer agree to have top-off wages or supplemental wages is kind of what other states call it, where an employee uses some of their sick time on a prorated basis to provide some more wage replacement over their paid family medical leave benefit, that is allowable, as in the proposed rules currently. That an employee could use some of their sick time too, if they're getting, for instance, 60% wage replacement overall, to use a prorated amount of their sick time to bring them to 100% wage replacement, that is allowable under proposed rules currently.
And so as we're continuing to get questions from the Q&A, don't hesitate to raise your hand if you want to speak in real time, and I'll recognize you. Right. So one question that we did get, so what happens if the employer does not know that the employee has been approved and used their accruals? Once they are accepted under the paid family medical leave plan, are the employers required to give the accruals back? So we definitely got a lot of comments around this in the first rule about employer notification. So we corrected that by putting in the second version of the rule, each time an employee has been either approved or denied or seeking reconsideration, we will notify the employer as well, just so both parties are aware and have as much information as possible about it. I know we talked about maybe adding the benefit amount that might be attached to it as well, just so if the employer wants to, but is not, again, not required, could supplement that worker's wages that they would have earned had they not taken leave. And in terms of the accruals, so an employee still has the right to accrue any sick time, vacation time, or any other benefits that they were given before taking leave. So that is something that is in the statute that's required. So they would not be likely required to give back any accruals that they've used. So we have a raised hand. So I'm gonna, Caroline, can you hear us?
Let's put it in the chat.
Oh, okay, you wanna put it in the chat?
Or
Okay.
if she does.
Oh, yeah, would you like to put your question in the chat or speak in real time? Not hear anything from Carolina, but again, if you do have a question, do not hesitate to raise your hand and or you can add it into the chat as well. So the next question we have is what happens to the money I paid if I never use the benefit? So I guess this gets to the premiums.
Yeah, so this is I mean, it's essentially an insurance policy. It's what you would call a social insurance policy. So just like insurance policies, you know, if you pay and you don't use the coverage, it's not money that is, you know, reimbursed. It's premiums that you pay to receive coverage. So it's under that model. No, you do not receive reimbursement if you don't use the benefits. It's similar to, you know, health insurance and car insurance in that way, or social security disability insurance, you know, it's another model of social insurance. And that is per statute. That's a statutory structuring of the program.
So one question we got, does the state average weekly wage include overtime or other types of discretionary payments?
I don't even know, honestly.
Yeah.
That's a good question.
Yeah, so the state average weekly wage, I believe, is based on the statute. So, it's a very lengthy statute, but that is a great question maybe we can clarify.
We could probably put out some
Yeah.
clarity later.
Yeah, we can put out clarity later about that, but the state average weekly wage, we're basing it off of, existing law. That's a great question.
Is there two questions to just repeat?
Okay. All right, so do you have to be at your job for hundred and twenty days to apply? That's the first question. And the second question is, does eligibility start over at a new job? So to answer the first question, no, you do not have to be at your employer for hundred and twenty days in order to apply, but in order to, maintain the job protections around that particular job, you have to work for that employer for hundred and twenty days. So in theory, someone could apply on day one, and we have been very transparent about that process, because nothing in the law, prohibits anyone to be at a job at a certain amount of time in order to apply, which I know might be different than the federal medical leave, law.
And provided, I would add, provided they met the wage threshold in the
Yes.
previous job.
Yes.
So to be eligible to draw a benefit, you have to have made the 6 times the state average weekly wage in the previous year. So if you have, income from your previous employer and you move to a new employer and you've met the wage threshold for eligibility, but you're day 4 at the new employer and you have an event, yes, you can apply on day 4 at the new employer, but you do not have job protections until you're at
Right.
day 121.
Right.
Yeah.
All right, and then the second question is that, does eligibility start over at a new job? So, not necessarily, as long as you've met like the earnings requirement. Again, people work more than one job or work one single job. So that is part of your eligibility. You also have to apply for the program for one of the 4 qualifying reasons that we talked about, whether it's family, medical, safe leave, or leave related to, upcoming military deployment. And then any other eligibility that does not disqualify you, for the program. So another question we got was, are employers required to provide benefits during the leave? If so, how are the benefits paid for? I don't know if this is getting to benefits from the state, so, and this is where hopefully we'll lay out further later down the road. So, if an employee does decide to apply for paid family medical leave, it will be the state that will be paying those benefits, and the premiums that, are paid into, the paid family medical leave fund. One of the exclusive reasons are to pay for benefits and 2, any administrative costs. The benefits that you, as an employer, you do have to maintain, are the benefits that you gave them prior to taking leave. So either health insurance, retirement, anything of that sort, the employer is required to, maintain those benefits, while they are on leave. Next question is, can the employer require the employee to use PTO, to pay for an ancillary benefits while on leave? To use paid time off. I'm assuming if this is more required, so if we're talking about drawing down on benefits.
So I don't know if they're asking, so by statute, I think what they might be asking is, can the employer require some PTO time to cover the health insurance premiums that the employee would pay while they're on leave? It is my guess what they're asking. But the way the statute is written is you cannot, as an employer, compel the employee to use PTO time at all while on leave, is how we interpret it.
Next question is, did the state of Maine contribute to any dollars to fund the program? Yeah, so that's a good question. So so when the legislature passed, paid family medical leave, and included, $25 million to basically get the program up and running. And so part of that is to pay, salaries, Luke and I, and the other paid family medical leave team, and then any other costs associated with getting a program started. But yes, $25 million did come from the legislature to begin the program.
And eventually it will be self-funded.
Yes, and yeah, and to kind of get back to that question, so part of the premiums again that people will be paying into is to, one, pay for any benefits that go out, and then two, administrative costs. So over time, your premiums would be helping to fund both of those things.
And I know this question kind of comes up a lot with that one, but these premiums do go into a trust fund, so it is, essentially a locked box. That the money collected through premiums can only be used to pay out benefits in the future or to cover program administrative costs. They are not general funds for the state. The state cannot dip into them. They are segregated in the state treasury office as separate funds that by statute can only be used for paying benefits and running this program. So they are, a trust fund, a true trust fund that cannot be used for general state business.
So do subs count as employees?
Substitutes, yeah.
Yeah, I'm assuming substitute teachers, but yeah.
Yeah, all worker types, full-time, part-time, per diem, seasonal, they're all covered, for stat intermittent, per diem. Anything that's, any employment type is covered by statute. It's a broad stroke of what an employee is, any wages earned, basically.
So we still have a couple of about 9 minutes left, but again, if folks have questions, don't hesitate to raise your hand. And Caroline, I haven't forgot about you. I know you put your hand down, but please feel free to ask. So for employers with assuming more than 15 or less than 15, less than 15, less than 15, does the employer have to hold positions during that leave?
Yes, if it's
Yes.
over 120 days.
Yeah. Can the 1% premium be split up differently? So that's a good question. We've got about collective bargaining agreement.
Yeah, so the employee cannot be charged more than 0.5% of their wages. The employer could, because the statute says the employer may cover the employee's portion. So the employer can choose to cover a certain percentage of the employee's portion if they choose. So for instance, an employer could say of the 1%, I'm as the employer gonna cover I'm gonna cover 0.8% and the employees will cover 0.2%. The employer does have the discretion to chop up the employee's portion and pay some of it if they choose, provided, and this was a clarification we put into rule, provided they do the same for all their employees within a business. So you're not, doing a certain amount for your executives and a certain amount for a, line staff. It has to be the same for all. With the exception of that, if there's separate collective bargaining agreements in public sectors. So for instance, if you're a school and you have three separate collective bargaining agreements and you've negotiated a premium rate for each type of employee, they are allowed to do different for those separate collective bargaining agreements. So yes, the employer can chop up the 0.5% of the employee portion if they choose, as long as they do it, the same for all. But employer cannot charge the employee more than 0.5%. That's the ceiling for the employee, that the employee cannot pay more than 0.5% at any time.
So what is the process for an employee to file a PFML claim? At this time, the only information I would definitely say is that there is a monetary requirement and an earnings requirement. More information will be out about the process to apply for leave in the very near future. So we're certainly thinking about that and trying to provide information about that. What is the approval process for the state to validate the leave request? So I guess is another application question. So even though we will benefit, or the application process will begin in early 2026, we will likely review any wage information that they provide to us to make sure that they've hit the 6 times the state average weekly wage. We'll look at any documentation that we might require. Depending on also the type of leave, we'll look at whether the employee has been disqualified at all, because part of the law, if you are disqualified from the program due to the reasons that we laid out in statute, I don't have it with me, that could make you unqualified. But we will validate the applicant's claims through a process. And we'll also look to any, and then just talking again about undue hardship, because we kind of want to hit it home that this is something that is gonna be important for employees to know. And I guess maybe I'll add more about the approval process of the application process. So in our proposed rule, so when an individual applies for leave by statute, the employer is notified within 5 business days that one of their employees has applied for leave. And then we put as part of our rule, basically a 10-day hold on that claim to allow the employer to essentially weigh in to determine anything related to any undue hardship claims that might come up, which is why I wanted to kind of emphasize about that process and whether the employer's determination on undue hardship was reasonable. And then after, and any other eligibility factors, and assuming we don't hear from the employer, or if we do, then we move forward into the 10-day, move forward into the process after that 10-day hold has ended. And there obviously be an appeal process too and reconsideration.
Reggie, a related question is, how is the employee notified if their leave is approved?
So they will be, how will they be notified? So I don't know, maybe you haven't laid this out yet, but I'm assuming they'll be notified either through by mail or through some other electronic means. But again, I think once we get closer to individuals applying for the program, we will definitely have more information about how an employee is to be notified. But we did put in the rule that you will be notified, but the method of it, we haven't fleshed out yet.
Yeah, I would say, I mean, we are gonna be developing that obviously very thoroughly next year as we approach benefits. The majority of applications will be online, you know, that's how other states do it, but we recognize that we don't want to have applications only available online. So we want to make sure there's a paper process for people that need to mail in, that might not have access to a computer or a phone process. And similarly, any notification, you know, generally they would happen through online portal notifications, but we recognize that not everyone may have access to that. So we want to make sure we're being considerate of different populations and doing, you know, mail notifications or phone or text. So anything related to benefits, we're going to be fleshing out a lot more next year for sure. But we are going to try to, you know, do user-centric design and realizing that not everyone's going to have access to, you know, computers and online portals, but the vast majority of the applications will be through online portals.
So we got a couple of questions. So around the employee's portion of benefits, I'm assuming this is about health benefits and retirement. How do those get paid during leave? So the mechanism, how does the employer continue to pay those benefits?
Yeah, and we'll probably have to put out guidance on that, but it would be like, it would have to be a catch-up deduction or affirmatively billing, I think is another process where someone continues to pay their health insurance premiums even during a period of leave. Their employee health insurance premiums, obviously not the employer portion, because the employer does need to maintain coverage levels and benefit levels as if they were working. So the employer would, it's not like COBRA, for instance, the employer would continue to pay the employer portion of the health insurance, but the employee is, yes, still responsible for paying their share of their employee portion.
So how long is the approval process? So how long does it take from the time that they apply to when they get a decision? And essentially, does the state have the final say?
Well, it's kind of hard with the undue hardship. The state is ultimately the arbitrator of these claims, but the employer does have the right to claim an undue hardship under certain conditions. And the employee has, you know, a right to apply. And, you know, as long as they provide reasonable notice, there's more presumption on that. In terms of timeframes, I mean, we are the only state with an undue hardship, you know, clause in our statute, so it's a bit of an unknown, you know, that's gonna be data tracking that we'll do after benefits go live. I think in other states, you know, best practice is that these decisions are made generally within a week or two after full applications are received, and that's kind of a key point. Is once full applications are received, usually decisions are made in less than 2 weeks in other states. But again, our law is unique and we have unique aspects of our law, so it's data we'll be tracking as it goes live.
And right now we've hit the 6 o'clock hour, and I know we definitely have a lot of questions left, and we'll certainly do our best to try to get to them in the next maybe we'll extend it by a couple of minutes just so folks have an opportunity to ask. But the next question is, can you utilize the 12 weeks only one time per year, even if you have two qualifying events. So essentially, can you use 12 weeks for both one or more?
Yeah, no, it's
qualifying events?
only up to 12 weeks for one benefit year, so you cannot, even if you have two qualifying events, you only have a bank of up to 12 weeks for a paid family medical leave claim. If you have two separate events of shorter timeframes, let's say you have a medical event where you only take 4 weeks, and then you have a family member who gets sick and you need to take another 4 weeks, you can take separate claims within the same benefit year. But the available time cannot go over 12 weeks, per statute.
Awesome, thank you. So right now we're at 6:01. So we are at time, and I know again, we certainly appreciate all of the questions and answers that have been raised today. But I would definitely remind you to go on our webpage on paid family and medical leave. So again, that's www.maine.gov/paid leave. And the questions that we didn't get to today, we will certainly, as we're moving forward in the implementation process, try to answer them through our FAQs and other documents. But again, I just want to thank everybody for joining us here tonight. Again, I want to thank the Maine Paid Leave Coalition for being an amazing sponsor for this event. And so hopefully more folks are informed and have a somewhat better understanding about paid family and medical leave. Thank you all again, and have a great evening. Thank you.